fastest rising variant worldwide. Now, I need to qualify that. When we say fastest rising variant, that does not necessarily translate into a greater number of cases. If you take 100 COVID patients around the world, all that means is a greater percentage is from JN1 this week compared to previous week, and so on. So in developed nations, especially in the European countries, Canada, US, and so on, the number of COVID cases is in fact quite high. Many hospitals are overloaded, not all of them, but many hospitals are overloaded. Staff are coming down with COVID. They're taking time off. So the systems are being strained. So it's not just about the deaths of COVID that is straining these nations. So likewise, in my part of the world, that's Kerala, we have noticed an increase in the uptick or increase in the number of what we call upper respiratory symptoms, flu-like symptoms over the past couple of months, if you will. Unusually high. But as you know, in India, when patients go to a doctor, they don't really do a COVID test or influenza test. These things are expensive, cumbersome, and often deemed unnecessary by both the patient and the doctor. So for that reason, we do not have a large number of cases reported in India. And that's obvious when we look at the history of the pandemic in our country. But wherever testing was done for such patients, in months like August and September, there was hardly any COVID. I can confirm that. We've been tracking it even before it hit India. But come October, the numbers started creeping up. And in November, we saw about 7% of such patients were suffering from COVID and not from influenza. And it's among these 7%, perhaps, that they picked up one case of JN.1, and so many other sequences from the rest of India are pending their result as we speak. So it comes as no surprise that JN.1, which is a successful variant, if you will, that is infecting the rest of the planet, is also found in India, because India is well connected with the rest of the world by all sorts of travel modalities.
So I just want to come in here quickly. You mentioned, before we move further, you mentioned that it was COVID and not influenza. For a lay person, I just want to really bring it down to a basic level. For a lay person, is there any way to decide or any way to infer whether this is influenza or whether it is COVID? Of course, your basic check is there, but in terms of symptoms, is there any difference?
It's a good question. These symptoms that are described are common to many viruses which commonly circulate in the country and in the rest of the world, influenza included. Influenza is not the common cold. Many people seem to confuse common cold with influenza. Common cold does not affect your health any number of times you get it. It does not kill people. Influenza can kill people. It can cause pneumonia and can cause even a cardiac problem, just like COVID can. So COVID, influenza, and common cold are completely different entities, even though the initial symptoms may be similar. I'll give you an example. Polio starts with a case of diarrhea, but we don't see polio as a case of diarrhea, do we? We see it as a paralyzing disease. The paralysis comes later. Likewise, COVID starts with what we describe as common cold symptoms, but later on, people who survive COVID go on, some of them get other sorts of complications. So back to your question, symptoms are similar, which is why testing is done, at least in a few samples of cases, so that we have an idea of what is going on in the community. If you don't test, we have no idea what these diseases are, what treatments should be done, how they should be triaged, and what preventive measures should be taken. For instance, COVID spreads through smoke-like aerosols, which is like if I'm talking, I'm producing aerosols that are circulating in my room. COVID spreads through that. Influenza spreads more by large droplets. If I cough, if I sneeze, on my hand, I shake hands with someone, the virus gets onto someone else. So there's a slight difference in how these viruses are transmitted as well.
So I also